Hello, my name is Janice Yun. I'm a senior program manager with the Office for Diversity and Inclusion at the Mount Sinai Health System. Welcome back to another series of the Administrative Fellowship Spotlight. I'm excited to feature another fellow today. Hi, Dapo. Can you introduce yourself?
Sure. Hi, Janice. My name is Oladapo Durjaye. I go by Dapo. I'm currently an administrative fellow here at Mount Sinai West. I started my fellowship last year, July, and it's a 2-year fellowship. Before that, I graduated from Barry University in Miami, where I studied a master's degree in health services administration and also a master's in public health. Thank you.
Thank you for the introduction, Dapo. And I just want to thank you for joining me for today's Spotlight series. I'm excited to learn more about your experience.
Thank you.
My first question to you would be, what has been the most memorable, would you say, rotation or projects that you've worked on?
Um, It's a really nice question. So for me, the most memorable projects I've worked on, it's really hard because I've worked on so many projects. So I would have to say two of them. The first one being the COVID-19 vaccine distribution project. And I'll start with this one. So for me, like I used to live in Florida at least the last 7 years, and I applied for the fellowship after, getting close to the end of my master's degree program. And I was super happy and, blessed to get this fellowship here at Mount Sinai West, which was everything I wanted. And after that, of course, I moved here in July. We knew what was happening the whole of last year. We were in the middle of a pandemic. And just being able to move here at such a critical time. Like I remember telling my friends and family I'm moving to New York. And everyone's like, why you moved to New York during the pandemic? I'm like, yes, I'm going to chase my dreams. And, so moving here, everything was different. We had to mask up. There was like different policies in place due to COVID, looking for ways to like, get over this pandemic. Everything was different. There was lockdowns. You couldn't, life was different. So for me and for everyone else in this country and even in the world, we all needed that hope and knowing like when would this be over? When would this be away? When can we go back to doing the things we love? When can we go back to seeing our friends or going out or just socializing again? And it was a great thing when we started hearing, like we're gonna have a vaccine, something is coming up soon. It's been tested, it's effective. It'll help us get back to normal, which is what I think everyone craved for and wanted to, get to experience. And when the actual project came here, when we knew, look, we had this vaccine coming up, I was blessed to be able to work with the chief administrative officer here at Mount Sinai West, as well as the senior director of ambulatory care and some other people to like come up with the workflows and the processes where we can like, set up this vaccine distribution in a way that we're able to vaccinate as many people as possible while having a workflow that works. They didn't have to stay longer, like long wait times, and just looking for things like ways to improve the process. And for me, I'll say it wasn't easy at all. It was a lot of early mornings, a lot of late evenings. But again, it's just a reminder of why you chose to do what you do, one, and also just looking for ways to like get back to what life used to be. And just when we opened our doors to vaccinating in people, like we went from I'll say 300 employees. I mean, not just employees, but like people a day to going up to over 700 people were vaccinated on a daily basis, which I'll definitely say like it's a lot of work we put into that. But just the rewarding part of that is just seeing the people and their faces and the joy and the excitement. Some people haven't even gone out of their homes for like the entire, almost the entire year since this lockdown started, and just been able to come into the hospital and thank us. Thank you guys so much for doing this. I'm so happy. Maybe I'll get to see my granddaughter again. I'll get to see my son. Just the excitement in people's faces. It's one of the things and the reasons why I chose healthcare. Like I want to be able to help, like restore hope. Like help people genuinely, feel better, live healthier and happier lives. So just seeing that, we're part of this where people felt so excited to be able to like come in, get vaccinated, go back home, and living with that hope that yes, we're getting closer to things going back to how it used to be. I think that was very rewarding. I learned so much from there by working with the team members, working on their schedule, reporting their hours, doing their payroll, different things like that. Like I learned so much from it. And not just me, like it's definitely I work with a huge and amazing team that were like in different, like that were responsible for making sure this whole process was successful. So that for me was one of the most valuable projects I've worked on. Another one would be like as COVID began to wind down and cases went like reduced, I had the opportunity to be able to like explore other aspects of,
Mm.
the hospital system. And I was fortunate to get an interim role in materials management and supply chain, which for me is actually also like an amazing thing because one, materials management, it's super important, it's super critical in every department in the hospital, every clinical area. You need to know you have the right materials or you have the right supplies to treat the patients, whether the patients are having a surgery or they've been admitted or they just come into the ED. So just being able to work with the team, I learned so much working from them. I've learned, like, it's all about learning, like, right? If you don't learn, you don't grow. So I've learned so much, even though it's an interim role, I've still been able to, like, learn a lot from the associate director who worked in the department, from the director, the VP. Everyone has just been super supportive and been teaching me, like, ways to, like, help improve different processes. And I've helped, work with the team, learn what they do, look for ways to improve what they do. So it's been tremendous. It's been a great, valuable experience so far here in Mount Sinai West.
Thank you for sharing that. I'm not surprised to hear about those two experiences, or the most memorable ones, especially because of, you started at such a unique time when you joined our fellowship program, during the height of COVID, moving from Florida to New York and just being pretty much thrown right into dealing with COVID, right? It was certainly a challenging time. I think it was definitely challenging times for everyone. But like you mentioned, you also something good came out of it. You got to work in COVID vaccine, which is such a unique experience again. And also, supply chain and material management, they're really the backbone of operations, right? We can't treat our patients without proper gears and also
So
managing our inventory. We need to be really efficient with that. We can't afford to be not efficient in healthcare, right? And that's where material management and supply chains come in. So I think it's great that you're doing an interim role there. Um, so I just want to lead to my second question, and I know you kind of touched up on this, while you were answering my first question about some of the lessons learned. What would you say has been the biggest takeaway so far?
So one of my biggest takeaways so far would be definitely just being open to learning new things and being open to, like, you know, trying and exploring different things. Like, one of my coaches always says, like, every time I say something, it says hard work beats talent. When the talented thinks the talent is enough. So for me, like, I just feel like when it comes to work, you just have to put in the work. Like, it's important. Like, everything you do, you have to just put in the work, do quality work. And because whatever you do, like, it's gonna be super meaningful, super impactful. And aside that, just knowing that, be ready to, like, explore different areas. Like, for me, like, I've had to, like, work on, say, different projects, sometimes simultaneously working on 5 different projects with 5 different departments, and just making sure, like, you staying organized, and just making sure, like, you put in work, your work is effective, and you collaborate. And don't be afraid to ask for help. Like, you have resources around you. I have my team members that I work with. I have my managers. I have the VPs. I have the directors. I have a whole C-suite executives who are willing to see me grow and willing to see me succeed, and are there as resources for me if I ever need them. So I always, like, as much as I can, whenever needed, tap into these resources, because that's why they're there. Like, I'm here to learn. I'm here to grow. I'm here to be a better version of myself. Else I wouldn't be in a fellowship, right? So for me, I feel like that's one of my biggest takeaways: just being open to learning, being open to growing, and leveraging your resources, because that's why you have them there. And of course, they are all willing to help you grow, help you succeed, and help you become a better version of yourself.
Absolutely. I think that's a great advice. For everyone really starting out their career or, going into their fellowship program, it's really crucial to have that growth mindset, so that you're really willing to learn everything, anything, every day, right? Otherwise you're not going to grow or learn something new. So I think it's great you've been having that mindset, of putting in that hard work to learn as much as you can, because 2 years will fly by, right? I know, 1 year in, you already feel like, where did my 1 year go? Um,
Yeah,
Before you know it, your fellowship will be over. So, I'm really glad that you're doing really well at Mount Sinai West.
thank you. Appreciate that.
You're welcome. So my last question to you, Dapo, would be, I know a few years ago you were also in their shoes, students or candidates that really want to get into fellowship programs. What kind of advice would you like to share with those who are really interested in working in healthcare administration?
So definitely my first advice would be, one, don't be afraid to leave your comfort zone. I, as a person, I used to work in banking. I was in banking for 4 years. I had a great career there. Started as a teller, became a service manager before leaving. But then I always had a passion for healthcare. I knew this is what I wanted to do. Got my master's. In the middle of that, I heard about the fellowship and how we can help, propel my career. And not just that, also like gives me an opportunity to like learn from like the best leaders in the industry, which will be anyone's. I mean, at least my goal. So I'll say my biggest takeaway or my biggest advice for them will be definitely like stay committed to whatever it is that you believe like is what you're trying to accomplish with this fellowship, because definitely like it's gonna be rewarding, and just stick to the process, stick with it, and just know that it's not easy. Like I always say, if it was easy, everybody would do it, right? So just knowing like it's not gonna be easy, it's super competitive. If you're applying for fellowships, it's gonna be a whole lot of people also applying, but just stay committed, stay true to what you're trying to do, and don't be afraid to take risks. Like for me, I took a risk leaving banking. I was already set in stone, coming to healthcare, a whole different industry, but I'm super thankful I did that. I don't know what your story is, but if it is about taking risks, just take a risk, just own it, and just know like whatever decision I make, I'm gonna follow up through with it, and I'm gonna be committed to it, and you will succeed. Everything will work out. Just keep in the work, keep putting in the work, and just stay true to yourself. Absolutely, it's never easy, but it's possible.
Mhm. Thank you so much for that, Dapo. I think this wraps up today's interview. Thank you again for speaking with me, and it was an absolute pleasure learning more about your fellowship experience.
Thank you.
I look forward to hearing more. I know you still have one more year to go, so I'm sure there's more stories to tell in the future. But thanks so much again, Dapo, for speaking with me. Have a
Thank you so much for having me. Thank you. Appreciate this.
Thank you. Bye.